On 2nd January 1997, my father suffered from a heart attack that nearly took his life. He was just 2 minutes away from the hospital, so luckily he was saved. Otherwise, I would have lost him at the age of 11 when he was just 50. 4 years later, my mother suffered from diabetes. When she got to know that she had diabetes, she asked my father a simple question: why me? And she was right to ask this question. It wasn't her fault. Both my parents were genetically predisposed to these illnesses before they were born. But the most important problem was they didn't know when they were growing up, so they didn't protect themselves from the risk factors to delay the onset of the disease. 50% of our Pakistani population suffers from chronic diseases alone. In elderly, this number goes to 85%. They miss the most important part of life, the quality of life, because of lack of 4 A's, as I call it: awareness, acceptability, access, and affordability. In Pakistan, half of our population, 110 million people, never see a doctor in their lifetime. Another 49% pay out of pocket when they have to reach out to a doctor. Imagine not having money or access to a doctor when you need it. But it's not just that. People like my parents, even if they have the money or access, they don't accept their disease or don't know about it, hence never reach to a doctor, reach a diagnosis, and prepare the remaining years of their life. So when I was growing up, because of the medical tensions that we're having in my family, my parents thought it was inevitable that I become a doctor. I was the woman in the family, the youngest of 2 brothers, and came from a middle class, so I had to become a female doctor. But as I entered into medical college, and especially into the biggest tertiary care hospital during my house job, I realized that my parents weren't the only ones who were unlucky, but almost every patient that came to that tertiary care hospital was. Because they came with issues that could have been solved at a primary healthcare level, but because they did not have a doctor in their community, the issues turned into issues that had no cure. So they either came to the hospital to die or to give the comfort to their relatives that they finally had reached a hospital. As fate happened, and as I went into clinical practice, I got a job in a community clinic in Karachi, in an urban slum. And I realized in 9 months the presence of a doctor, how it can change lives in communities. I was diagnosing patients faster and giving them an opportunity to at least fight the disease that they would have later. But I got pregnant, and in 9 months, I had to shift to a new city. I had to shift to Lahore. And with a new baby, a new city, and nothing to do, and not being able to continue as a medical doctor, it pushed me into postpartum depression. And at that time, another ring of fate happened, my eureka moment. So the nurse who used to work with me in that clinic called me one day and said that there is no female doctor to replace you in the community. So I told her, whenever a patient comes to you, you take me on call. And later on, she taped a small video camera on her laptop and I started doing online consultations. And then I realized, I'm sitting in my home in Lahore. I'm consulting a patient in a small community in Karachi through a nurse. This could solve the 4A challenge that I've seen in tertiary care hospitals and in my primary care practice. And there it was, led to the creation of Sehat Kahani. I was a 26-year-old doctor with no prior training in entrepreneurship, business, or finance. But I had a resolve and purpose that online doctors across the globe can provide quality, affordable, and accessible healthcare to patients irrespective of their socioeconomic divide, their urban-rural divide, or their gender. When I started Sehat Kahani, I thought that health is a problem for the low income. But as I delved deeper, I realized that health is a problem for you and me also. When we live in urbanized, fast-moving cities, going to a doctor becomes a challenge. How many of us don't reach out to a doctor and don't understand the risk factors that our symptoms are bringing us in time? So that's when I created Sehat Kahani, the impact business. In low-income areas where patients don't have access to physical doctors, we create telemedicine clinics. Here, a nurse sits physically, and when the patient walks in, the nurse connects the patient to an online doctor. We have e-tools in the clinic in the form of e-stethoscope, dermoscope, heart monitors to make rapid diagnosis. So today, patients in Majka, Lodhra, Rahim Yar Khan, Lorelei, AJK, are getting access to doctors that were beyond their reach from all over the world, sitting in that clinic at an affordable price. And for patients who live in urbanized, fast-moving cities, we created Sehat Kahani mobile app. This app allows a patient to connect to a doctor individually. And the biggest USP is we have the ability to connect a patient to a doctor in less than 60 seconds. Because for these patients, convenience is the biggest issue. So if you want a doctor at 12 a.m. in the night or 6 a.m. in the morning, you can get it on the Sehat Kahani application. This app is devised for individual consumers as well as corporate users and their families. When COVID came into Pakistan, we turned crisis into an opportunity. Sehat Kahani was one of the only available telemedicine platforms in Pakistan that allowed a patient to consult to a doctor online. So it got picked up by the government, and in 6 months, we changed the way healthcare was being provided in the country. We did 110,000 consultations across 11 countries, where Pakistani diaspora patients connected to our doctors and got help at home in that critical time. And that got me thinking, this is the right moment for digital disruption to happen. And we accelerated on our expansion plans. So in the last 2 years, Sehat Kahani grew 7x. We now have 50 clinics across the country in rural areas of Sindh, Punjab, KP, Balochistan, as well as Azad Jammu and Kashmir. Today, 650 corporates from insurance companies, banks, telcos, pharmaceutical use Sehat Kahani app. And the biggest beauty is that the CEO of the company and the cleaner both use same app and same doctors to connect. True democracy. We have today been able to provide online healthcare to 1.9 million people and created a network of 7,500 healthcare professionals, mostly including female doctors who have come back to work after a break. And as for me, I got the opportunity to represent Sehat Kahani and my work at multiple international platforms, showing the good work that we've done in healthcare in Pakistan. I became a young global leader by the World Economic Forum. I got the Rolex Award Enterprise Associate Laureate Award for my work as the first female from Pakistan. I became a We Empower awardee, and I also got the Heroine of Healthcare Award from the Women in Global Health Forum, which was only given to first 4 women before me. Sehat Kahani in 2022 was also named as one of the companies in the Forbes 100 to Watch Asia list. As a female-led company and as a telehealth entrepreneur, this was a great moment of pride for me. So people ask me, what continues your motivation? What makes you do this every day? And my answer is, every day we solve the 4A challenge. So if it's a patient coming in Mansehra and being diagnosed for thyroid cancer through video, or a woman who's faced infertility for the last 20 years and giving them a miracle of a child, or a bank employee's father who got diagnosed with heart attack and was able to reach a hospital on time, or a societal patient who was 16 years old and he called us from the bathroom because he could not face his parents sitting in the drawing room and got connected to a psychologist, that's the power of telehealth and what can it do. Because I truly believe that in a country like Pakistan, where there's half a doctor for 1,000 patients, the future of digital, the future of healthcare is truly digital. Today, we have doctors connecting patients online, but tomorrow we can have interventions like ChatGPT, in which the bot does the initial screening and only a limited number of patients get connected to doctors. Even the data of the 1.9 million patients that we have, through that data, we send patients automated appointment reminders, medicine reminders, preventive healthcare messaging. So the beauty of data and the beauty of technology is huge. My parents suffered from health issues because of lack of awareness, but this is what we can bring back to the future generations. Digital healthcare interventions can change futures, change the years of life, and change quality of life for so many of our future generations in Pakistan to come. So the last 6 years have been years of faith, perseverance, years of passion, and it hasn't been easy being a female entrepreneur. But I have stuck fast as a mother, as a daughter, as a sister, because I draw strength from my idols, from my parents, who despite all their medical complications gave me a platform to grow. And I believe that the intervention of Sehat Kahani and many more interventions like Sehat Kahani can solve so many regional challenges for other countries. So today we resolve that in the next 6 years, we will impact at least 6 regions across the globe where patients can have good quality of life through interventions like Sehat Kahani, and we can give them a chance of a holistic life. Thank you.